So next, let's talk about heart sounds. When you listen to the heart, you hear two sounds. We refer to these sounds as the lub-dub. And this is associated with the closing of those valves. So the first sound, or the lub, is the closing of the AV valves at the beginning of ventricular systole. The second sound that you hear, or the dup, is the closing of the semilunar valves at the beginning of ventricular diastole. And the pause between the two sounds indicates the relaxation of the heart. So the mitral valve closes slightly before the tricuspid, and the aortic valve closes slightly before the pulmonary valve. So the differences allow for auscultation, or the listening of the heart, of each valve when a stethoscope is placed in 4 different regions. So we can place the stethoscope in specific places on the body in order to listen to the aortic valve, the tricuspid valve, the pulmonary valve, and the mitral valve.